What would happen if I told you that the solution for stronger and longer lasting erections isn't at the pharmacy, but literally in your own hands? I know it sounds too simple, maybe even impossible. After all, you've been told your whole life that virility fades with the years, that it's a natural part of aging, that the only way out is that little blue pill that leaves you with a headache and makes you feel dependent. But what if all of that was only part of the story? What if there was something so simple, so accessible, that you could do in the privacy of your home for just 2 minutes a day that would change not just your erections, but your energy, your confidence, and your sense of control over your own body? I'm Dr. Evelyn Carter, a urologist with over 30 years of experience specialized in men's health. I've worked with thousands of men in their 50s, 60s, 70s, and even 80s who came to my office feeling defeated, ashamed, convinced that their sex life was over. And what I've discovered over these 3 decades is something that conventional medicine rarely mentions. There's a simple protocol, a 2-minute massage that activates zones of the body that most men don't even know exist. It doesn't require a prescription, doesn't need expensive supplements, produces no side effects. It only requires your hands, your attention, and your commitment. Today, I'm going to reveal this complete protocol to you. I'll show you exactly how to do it, step by step. I'll explain the science behind why it works, the neurology, the blood flow, the hormonal activation. And I'll tell you real stories of my patients who went from desperation to confidence in weeks, not years. Before continuing, if this video is being useful to you, please give it a like and subscribe to the channel for more men's health tips that actually work. And if you're ready to change your life, write a 1 in the comments. Let me start by telling you the story of Michael, a retired architect, 64 years old from Chicago. Michael came to my office with a problem I've heard hundreds of times: weak erections, sometimes incomplete, that would disappear at the least expected moment. He had tried the pills, but they made him feel anxious, with palpitations and headaches. The results were inconsistent. One night it worked, the next it didn't. He felt like he was playing Russian roulette with his intimacy. "Doctor," he told me, "I've tried everything. Exercise, diet, pills. Nothing seems to work consistently. Is there anything else?" I asked him a question that left him thinking. "Michael, have you ever worried about blood flow in your pelvic area?" He looked at me confused. "Blood flow? I thought that's what the pills did." "Yes," I said, "but pills are a temporary solution. What you need is to reactivate your body's natural system." And that's when I introduced him to something that would change his life. The perineal massage. Step number 1. The perineal massage. The forgotten highway of blood flow. Maybe you've never heard the word perineum. It's that small area of skin and muscle between the scrotum and the anus, an area that goes completely unnoticed, that no one teaches you to care for, but that is absolutely vital for male sexual health. It's like a hidden highway that connects your entire reproductive system, but over the years gets blocked by tension, sedentary lifestyle, and poor circulation. Let me explain. What's happening down there? The perineum isn't just skin. Beneath that area are the pelvic floor muscles, a set of muscles that support your bladder, your rectum, and most importantly for this topic, that control blood flow to your penis. And running through this area are the cavernous arteries, the main highways that carry oxygen-rich blood directly to the corpora cavernosa, those spongy tissues inside your penis that fill with blood to create an erection. Think of it like a garden hose. No matter how powerful the water pump is, if someone is stepping on the hose, the water won't flow with force. Your perineum is that hose. And as you age, sedentary lifestyle, sitting many hours a day, poor posture, accumulated stress, all of that creates tension in the pelvic floor muscles. Those muscles become rigid, tense, and literally step on your hose. Blood flow reduces, pressure drops, and erections weaken. When I explained this to Michael, his eyes lit up. "No one has ever explained this to me," he said. "I always thought it was just about age." "No," I said. It's about circulation, about muscle tension, and about activation, and all of that can be improved. The perineal massage, when done correctly, acts as a liberator. It helps relax those tense muscles, reduces pressure on the arteries, and most importantly, promotes what we call vasodilation. That is, the opening of blood vessels. Imagine you're opening the floodgates of a dam. Suddenly, the water flows with more force, with more pressure. That's exactly what happens with your blood flow when you release the tension in the perineum. Now let me teach you exactly how to do it. It's simple, but every detail matters. Sit comfortably in a chair or lie on your back in your bed. Use the tips of your index and middle fingers. If you want, you can apply a little coconut oil or neutral massage oil. It's not mandatory, but it helps your fingers glide better. Now, locate the perineum. It's that area between the scrotum and the anus, right in the center. Press gently with your fingertips. You don't need much pressure, just enough to feel the muscle underneath. Start moving your fingers in small circles, very slowly. Imagine you're drawing circles the size of a coin. Keep the pressure constant but gentle. It shouldn't hurt. If it hurts, you're pressing too hard. The sensation should be one of release, of relief, like when they massage a tense muscle in your neck. Do this for a full minute. Don't rush. Breathe deeply while you do it. Inhale through your nose, exhale through your mouth. Focus on the sensations, the warmth of your fingers, the gradual release of tension. Michael tried this for a week, just 1 minute a day every night before bed. When he returned to my office, his face had completely changed. "Doctor," he told me with a smile, "not only is my erection firmer, but I have more control. I feel something I hadn't felt in years, a real connection with my body. And that's exactly what happens. You're reconnecting with a part of your body that's been working in silence, suffering in silence, waiting for you to pay attention. But here's the interesting part. The perineal massage alone is powerful, but when you combine it with the second step, something magical starts to happen. Because it's not just about blood flow, it's also about hormones, about testosterone, about vital energy. And that brings us to the next massage, one that most men would never consider, but that is absolutely transformative. Step number 2, the scrotal massage, the forgotten engine of testosterone. After Michael experienced the benefits of the perineal massage, his next question was inevitable. "Doctor, is there anything else I can do?" I knew he had found the thread of something deeper, not just a quick patch, but a real and sustainable solution. And that's when I introduced the second step of the protocol, the scrotal massage. Throughout my career, I've seen countless men struggling not just with weak erections, but also with symptoms that seem unrelated. Chronic fatigue, loss of muscle mass, mood changes, lack of motivation, difficulty concentrating. And when I review their blood tests, I almost always find the same thing: low testosterone levels, the master hormone of virility, energy, and male vitality. What most men don't know is that testosterone isn't produced just anywhere in the body. It's produced mainly in the testicles. And the testicles, to function optimally, need a very specific environment. They need to be at a slightly lower temperature than the rest of the body. That's why they're outside the abdomen, hanging in the scrotum. That bag of skin isn't just a container. It's a sophisticated thermoregulation system designed to keep the testicles at the perfect temperature. But here's the problem: sedentary lifestyle, sitting for hours, wearing tight underwear, being overweight, all of this raises the temperature in the scrotum. And when the temperature rises even just a couple of degrees, testosterone production plummets. It's like an engine that overheats. It stops functioning efficiently. The result isn't just low libido, it's fatigue, it's muscle loss, it's brain fog, it's irritability. It's a cascade of symptoms that affect your entire life. I met Robert, a taxi driver, 59 years old, from Boston. Robert didn't just have problems with erections. He was exhausted all the time. "I wake up tired," he told me. "I have no energy for anything. And yes, my sex life is dead, but "Doctor, I don't even care because I don't feel like doing anything." When I reviewed his testosterone levels, they were rock bottom, 280 NEDL. Normal for a man his age should be above 400, ideally close to 600. I asked about his habits. Robert spent 10 hours a day sitting in his taxi. He wore tight underwear. He was overweight. All of this was literally cooking his testicles, killing his testosterone production. I taught him the scrotal massage, and in 6 weeks his levels rose to 520 NGDL. But more important than the numbers was what he told me. "Doctor, I feel like I'm living again. I have energy, I have desire, my wife notices the difference. It's like I woke up from a dream." So how does the scrotal massage work? It does 2 incredibly important things. First, it improves blood circulation in the area. More blood flow means better heat dissipation, better tissue oxygenation, and a healthier environment for the testicles to do their job. It's like opening the windows of a hot room. Fresh air enters, the temperature drops, everything works better. Second, and this is something very few doctors mention, scrotal massage helps reduce accumulated muscle tension in the area. Just as you have tension in your neck or back, you can also have tension in the scrotum and surrounding muscles. That tension compresses blood vessels, reduces flow, and creates discomfort. The massage releases that tension, creating an optimal environment for testicular function. Now, let me teach you how to do it correctly. This is a delicate massage, not aggressive. It's not about squeezing or applying strong pressure. It's about gentle movement, about activating circulation. Sit or lie down comfortably. Use your clean hands. If you want, apply a little coconut oil so the movement is smoother. Gently hold the testicles with one hand. Don't squeeze them, just hold them. With the other hand, use your thumbs to gently massage the skin of the scrotum. Move your thumbs in small circles, covering the entire surface of the scrotum. Don't apply direct pressure on the testicles themselves. Just massage the skin and surrounding tissue. You should feel warmth, relaxation. After about 30 seconds, change focus. With the thumb and index finger of one hand, locate the spermatic cord. It's that duct that comes out of the top of the testicle and goes up toward the abdomen. You can feel it like a thin cable. Gently massage this cord with upward movements from the testicle upward. Do it carefully, without pulling or pressing hard. This massage helps release tension along this vital pathway, improving blood and lymphatic flow. Do this for a full minute, alternating between both testicles. Breathe deeply while you do it. Focus on the sensation of release, of connection with your body. Robert did this massage every day for 4 weeks. At first, he was skeptical. "Doctor, does this really work?" But after 2 weeks, he started noticing changes. "I feel more awake," he said. "I feel like doing things. And yes, my erections are also improving." After 6 weeks, the changes were undeniable. Not only had his testosterone gone up, but his energy, his mood, his libido, everything had improved. And here's the key. Scrotal massage isn't an isolated trick. It works in synergy with perineal massage. One improves blood flow to the penis, the other optimizes hormonal production. Together, they create a complete system of sexual and energetic activation. But there's still one piece missing. A piece that most men completely ignore and that can sabotage all your efforts if you don't master it. It's about the nervous system, about anxiety, about the silent stress that kills erections even when everything else is working well. Step number 3, deep breathing and anchoring, the master switch of the nervous system. Now we come to the part that many men overlook, but that is absolutely crucial. You can have the best blood flow in the world, you can have optimal testosterone levels, but if your mind is in panic mode, if your nervous system is on maximum alert, your body simply won't allow an erection to happen. And this is something I saw clearly in the case of James, a high school teacher, 61 years old from Seattle. James came to my office after trying both massages for 3 weeks. "Doctor," he told me, "I feel like something is improving. Sometimes I have firmer morning erections. I feel more energy. But when the moment of intimacy with my partner arrives, everything falls apart. The anxiety kills me. I start thinking, will it work this time? Will I be enough? And those thoughts are like poison. The erection disappears before it starts. This is a problem I've seen in hundreds of men. Performance anxiety. It's a vicious circle. You have a weak erection once, you worry about it. Next time you're so anxious you can't even start. And each failure reinforces the anxiety, creating a pattern that seems impossible to break. But here's the scientific truth that changes everything. Erection isn't just a vascular phenomenon. It's also completely controlled by the nervous system. Your body has two main nervous systems that control automatic functions: the sympathetic system, the fight or flight one, and the parasympathetic system, the rest and digest one. When you're stressed, anxious, or worried, your sympathetic system activates. It's the system that prepares you to face danger. It increases your heart rate, tenses your muscles, and most importantly for this topic, restricts blood flow to non-essential areas like the penis. From your body's point of view, if you're in danger, it's not time to reproduce, it's time to survive. The parasympathetic system is the opposite. It's the system that activates when you're relaxed, calm, safe. It's the system that allows blood flow to flood the penis, muscles to relax, erection to happen naturally. And here's the problem. Most men, at the moment of intimacy, are in sympathetic mode. They're in their heads, worried, anxious, evaluating themselves. And that kills the erection before it starts. The solution is simple but requires practice. You need to learn to intentionally switch from sympathetic to parasympathetic system. And the most powerful tool to do this is deep breathing. It's not mysticism. It's pure neuroscience. When you breathe deeply, slowly, and controlled, you send a direct signal to your brain that says, everything is okay. You can relax. This signal activates the vagus nerve, the main nerve of the parasympathetic system, and your entire body changes state. I taught James a specific technique that combines breathing with mental anchoring. While you do the perineal and scrotal massages, you're going to add this third step. Inhale deeply through your nose for 4 seconds. Feel how your abdomen expands, not your chest. It should be an abdominal breath, deep. Hold the air for 2 seconds. Then exhale slowly through your mouth for 6 seconds. Exhale all the air, feeling how your abdomen contracts. Repeat this 10 times while you do the massages. This ratio of shorter inhalation than exhalation is key. It tells your nervous system you're in safety mode, in relaxation mode. But it doesn't end there. Anchoring is the second part. As you breathe and massage, focus completely on physical sensations, the warmth of your hands, the texture of your skin, the pressure of the massage, the release of tension. Don't think about the result. Don't ask yourself if it will work. Don't plan what will happen next. Simply be present. Anchor your mind in the moment, in the sensations. This anchoring prevents your mind from escaping to anxiety. It's like tying a boat to the dock. Without the anchor, the boat drifts with the waves. With the anchor, it stays firm, stable. Your mind is that boat, and physical sensations are the anchor. When James started practicing this, everything changed. After 2 weeks, he told me, "Doctor, it's incredible. I'm no longer in my head during intimacy. I'm in my body. I feel everything. And the erection just happens, effortlessly, without anxiety. It's like I recovered something I had lost years ago." And here's the beautiful part. This third step doesn't just improve your erections, it improves your entire life. The ability to control your nervous system, to switch from stress to calm at will, is a skill that will serve you in every aspect of your life. At work, in your relationships, in your mental health, it's the master switch that most men never learn to use. But now you have it. So let's recap the entire protocol. It's 3 simple steps, just 2 minutes a day, that when combined create a complete system for restoring male sexual function. First step, perineal massage for 1 minute. release of muscle tension, improved blood flow to the penis, activation of cavernous arteries. Second step, scrotal massage for 1 minute. Optimization of testicular temperature, improved circulation, support for natural testosterone production. Third step, deep breathing and anchoring for 10 repetitions while doing the massages. Activation of the parasympathetic system, reduction of anxiety, mind-body connection. These 3 steps, when practiced with consistency, aren't just a technique. They're a commitment to yourself, to your health, to your vitality. They're 2 minutes a day that can change the course of your sex life, your energy, your confidence. I've worked with hundreds of men who have followed this protocol. Some saw results in days, others in weeks, but all experienced significant improvements, not just in their erections, but in their overall sense of well-being, of strength, of control. And best of all, this doesn't depend on a pill, on a supplement, on a doctor. It depends on you, on your commitment, on your willingness to care for your body the way it deserves. I know that for some of you, these 3 steps may be enough, but I also know that some men need a little more help, especially if they've been struggling for years, if they have more complex underlying conditions, or if they simply want to accelerate results. And that's okay. There's no shame in seeking additional support. In fact, it's a sign of strength, of commitment to your health. If you feel you need something more, something that works together with this protocol, I invite you to explore the natural options that exist. There are specific supplements designed to improve blood flow, to support testosterone production, to reduce inflammation in the reproductive system. They're not magic pills. They're tools that, combined with the right habits, can amplify your results naturally and sustainably. But the most important thing I want you to remember is this. You deserve to feel strong. You deserve to have reliable erections, sustained energy, confidence in your body. It doesn't matter how old you are. It doesn't matter how long you've been struggling. Your body has an incredible capacity for healing, for regeneration, for response when you give it the right tools. This 2-minute protocol is one of those tools, simple, accessible, powerful. So I invite you to start today. Tonight, before bed, take 2 minutes. Do the perineal massage, the scrotal massage. Breathe deeply. Do it with intention, with presence, with commitment, and repeat tomorrow and the day after and the next day. Consistency is the key, not perfection, but constancy. 2 minutes a day, every day, can change your life. If this video has helped you, if you learned something new, please give it a like and share it with someone who needs it. Subscribe to the channel for more men's health tips based on real science and clinical experience. And write to me in the comments. Tell me if you're going to try this protocol. Tell me your doubts, your experiences. I'm here to support you. I'm Dr. Evelyn Carter. Your sexual health matters. Your vitality matters. And the best time to start taking care of it is right now. See you in the next video.